Good afternoon, everyone, and thanks for joining us this afternoon for our last event of the year. I'm Sean Godar, Vice President of Strategy and Analytics at Employers Health and Co-Director of Right Direction. I'll serve as a moderator of this event. We're really excited today about today's speaker, but before we begin, a few housekeeping items. All attendees are currently in listen-only mode. Please send any questions you have using the question function in your control panel. We look forward to addressing your questions at the end of the presentation. And if you ever have any difficulties hearing me or the speaker, please raise your hand in the control panel and we will be in touch to assist. Finally, there's a handout section in your control panel where you can download materials related to today's presentation. Upon exiting the webinar, you will receive a survey to provide feedback. We appreciate all attendee feedback in order to provide future valuable education opportunities for upcoming events. We will also send out a follow-up email tomorrow with a link of the recording event and its accompanying handout. Submit your questions at any time in the chat function and we will answer those during the Q&A section. With that, I will turn it over to my colleague, Darcy Gurdaro, who is the Director of the Center for Workplace Mental Health and my fellow co-director of Right Direction. Darcy?
Great, thank you so much, Sean, and welcome everyone. I'm glad you're joining us today. We've really enjoyed this virtual town hall series, and today we have an excellent presentation in store. So we are going to talk about addressing burnout in the healthcare sector and beyond. And I just wanted to mention that Right Direction, it offers employers and employees high impact resources to really address raising awareness about depression and really encouraging help-seeking behavior as early as possible. And as Sean said, this was created through a partnership of the American Psychiatric Association Foundation and Employers Health. So we are working together to really raise awareness about depression and encourage people to get help when it's needed. I don't think I have to tell anyone here that the world has changed and that mental health has really taken center stage. So in the news, nearly every day, there are stories about the importance of mental health and what a big role it is playing, sadly, and in a very concerning way as a result of the pandemic and many of the other economic downturn, some of the political tension that we've had in this country, not to mention racial issues as well. So just to really bring that idea home, I did want to share that the Census Bureau and the CDC have been collecting through a pulse survey weekly data on a number of different items, including people experiencing signs or symptoms of anxiety and depression. And the latest data, I know this is not an easy chart to read, but if you look at on the far right, the circled numbers, the top number is the number of adults in the United States experiencing anxiety and/or depression at 42%, which is way above what we typically see in people experiencing symptoms of these conditions pre-COVID. And then the other data point I wanted to draw your attention to is if you look at the age bands, the 58.1%, so nearly 60% of 18 to 29-year-olds. So these are young adults, and many of our workplace settings are really experiencing high rates of symptoms of anxiety and depression to the tune of 58.1%, almost 60%. So it's very timely that we should be talking about burnout, stress, and the intersection with mental health. Before I turn this over to today's excellent presenter, we do have two poll questions that we are putting forward for this virtual town hall meeting. This will help us in our planning for 2021 to really address what are the most important and most valuable resources that you need in the work that you do to address depression and mental health. So we're going to give you just a minute to respond to this poll, and then I will introduce our speaker. Okay, thank you very much. We really appreciate your feedback. That's really important to the work that we do. So thank you very much. And now I have the pleasure of introducing today's presenter. Dr. Agarwal is a psychiatrist. He is also an associate professor in the departments of psychiatry and behavioral sciences and medical education at Northwestern's Feinberg School of Medicine. He's also the director of physician well-being at Northwestern Medicine Medical Groups. Dr. Agarwal is a nationally recognized educator who's won multiple prestigious awards for his work. He serves as a wellness consultant to multiple national research groups and is a certified leadership, organizational, and well-being coach. He specializes in occupational and organizational psychiatry with an emphasis on workplace mental health. I have the great pleasure of working with Dr. Agarwal in his role as a valuable member of the Center for Workplace Mental Health Advisory Council. So with that, I'm going to turn the presentation over to Dr. Agarwal.
Thank you, Darcy, and thank you to the audience for taking the time to attend this webinar and really learn about ways to support your people. Let me make sure I have control here. So I always like to begin my talks with why this matters to me, and hopefully should matter to others. As a psychiatrist, it's almost obligatory to start with Freud, so I quote him to explain my why. He said, "Love and work are the cornerstones of our humanness." He is thought to have gone on to say, "The capacity to work and love are the markers of good health." Thus, if something is hurting our capacity to work, it's a direct threat to our health. This has been my experience as my clinical practice is around evaluating healthcare professionals such as doctors, pharmacists, nurses, executives from around the country who've become impaired and cannot do their work safely. At this point, I've met probably about 1,000 colleagues, and each time I meet someone, I reverse engineer their lives and try to figure out, how do we get to this unexpected point? While their stories were all unique, the common pattern of dissatisfaction with work and burnout kept emerging upstream to the problems of substance abuse and mental illness that I was usually seeing them for. I decided that while evaluation and rehabilitation was important, I wanted to be a part of prevention so that my colleagues would never have to get to the place of needing to see me, and that the patients they care for would always receive the excellent care my colleagues are capable of delivering. Through my role as Director of Physician Wellbeing at Northwestern Medicine, I've had the chance to learn a few core concepts on our journey to achieving well-being that I'll share with you today in the hopes that it can be useful on your own journey. So I'll begin by making sure we're on the same page on what we're speaking about when we say burnout. It was described decades ago and initially referred to the caring professions and required 3 parts. People found that while caring for others, there was an inherent stress and the challenges that could drain your tank and potentially lead to this feeling of being emotionally exhausted, or kind of the idea that I just don't have anything left to give. As a defensive response to that feeling, folks would then distance themselves from their patient so that they could protect themselves from being too emotionally invested. This step was called depersonalization. So kind of an example would be if I wanted to detach myself from Mrs. Robinson, who's my neighbor, I want to think of her as the woman in room 10. The issue, of course, is there's a side effect to that detachment, and that's that one can no longer feel the deep satisfaction and meaning you get from helping your fellow human whom you identify with because you have now depersonalized them. That led to this feeling of being ineffective and sort of having the thoughts of, what's the point? Does what I do even matter? All 3 components made up the dynamic model of burnout. And as you can see, it really seemed to apply to the professions where you're caring for others. That model has been expanded in ways that is more able to include all professions. Last year, the WHO even included it in their ICD-11 as a problem related to employment or work that conceptualizes it with those same basic 3 components and as kind of chronic workplace stress that's not managed sufficiently. This opens up the idea more broadly to all work, though I think some of the manifestations and implications of that are still not perfectly understood. Now that we understand what burnout is, I think we also need to understand what it is not. It is not the presence of stress at work, which is unavoidable. I think it's important to highlight that we don't think stress is inherently bad, as the curve here indicates some level of stress is necessary to achieve optimal performance. It's the issue of having too much stress for too long a period without sufficient support and resources to effectively manage your stress that is the threat to performance and health. And that is what we are trying to design solutions around. Of course, as Darcy pointed out, we find ourselves in the midst of a pandemic and frankly, numerous other stressors in society that make achieving that optimal stress balance much more difficult. We know that the psychological fallout from the pandemic will both be larger and last longer than the already considerable medical fallout of the crisis, and that will affect all workers, and especially workers in my field, for years to come. Why is the psychological fallout so great? Well, in normal times, we can subcategorize stress as coming from 4 generic buckets. This idea of traumatic injury or life threat, loss or grief injury, moral injuries or inner conflict of values, and then fatigue injuries or wear and tear. And normally, people experience stress from 1 or 2 of those buckets at a time. But the pandemic has resulted in many people, especially folks in healthcare, experiencing stress from all 4 buckets at the same time. This is then further compounded by the fact that the usual tools many of us use to counteract stress are not available to us. And you can see how quickly stress thermometers can spike in that sort of a scenario. When those thermometers start running high, it can manifest in many ways, and knowing those signs and symptoms is important so you can educate workers on the warning signs to be on the lookout for within themselves and in their peers. This is how people can proactively seek and encourage others to seek help and utilize the resources you provide them as an organization. Without helping them with self-awareness and peer support, you may spend lots of money and have great resources, but your people will not be healthier because they'll not be benefiting from them. This is especially true in my field, where a great deal of stigma still poses a barrier to utilization. As you can see here, the emotional symptoms of stress include irritability, intolerance of others, suspiciousness, fussiness, feeling overwhelmed and depressed. Behavioral signs of stress include increased smoking or substance use, difficulty getting to sleep, increased risky behavior, over and under eating, grinding your teeth, facial tics, etc. Physical symptoms include nausea, indigestion, headaches, constipation. Again, our guts and our brains are very intimately connected, and so a lot of times those symptoms manifest there. And then finally, kind of how does that all manifest at work in terms of burnout? You have some of those types of cynicism or disillusionment. What's the use? I'm just going through the motions. You'll see changes in self-care. Someone might come in who's impeccably groomed normally, hasn't shaved, their white coat has stains on it. You'll start noticing changes in professionalism, tardiness, the quality of the work's declining. They're much more impulsive and irritable. And so some of those warning signs for us help us know how to intervene early, or certainly be even proactive about encouraging folks to seek help. If I were you, I hope you're thinking, well, given the situation we are in and the inherent nature of certain work, what does he expect anyone to do? Because there will be stress right now, and people will be experiencing the symptoms I just described. I agree. Currently, in my view, our major goal in addressing burnout and stress in my field has to be making sure we provide protection to our workers from the known occupational hazards of providing healthcare in the middle of a pandemic. This gentleman has known hazards wherever he works at his job, and his employer knows this, and they provide him with that hard hat, the eye protection, the ear protection, and appropriate environmental conditions to mitigate risk. As healthcare organizations, we must provide analogous resources to our employees to protect them with both physical and psychological PPE. While this framework is useful both now, and I think it will be as useful in the post-pandemic world, the goal is not to return to the way it was, but to create a new normal, because the way things used to be wasn't working for us either. This chart demonstrates the level of burnout across various physician specialties, and you can see a wide range, but the average overall was in the mid-40s, and that was actually a reduction in 2017 compared to 2014. But it's not just doctors, but everyone in the healthcare organization reported burnout, including nurses, executives, physician assistants, and clinical leaders. This, to me, is the data that should be convincing that this is not a problem of individual resilience. When everyone is struggling, it's not them, it's the system. And thus, the solution has to come at a system level, both as a healthcare ecosystem and at the level of individual organizations. You heard my why to start this talk, and I believe that the moral ethical case should be enough. But organizations also have a clear business case about why they should care about this too. All the metrics we aspire to as healthcare organizations are at risk when the workers are burned out, including access to care, productivity, safety, quality, turnover, retention and recruitment, and healthcare and benefit costs. If that's not enough, I think you need to know that this phenomenon is contagious. And as more folks in your organizations get burned out, the risk to that spreading amongst your other employees is quite high. The silver lining is that just as burnout is contagious, so is engagement and satisfaction. And that is the power we want to leverage as we go on our journey of improving systems. I use that word journey intentionally. If you go down this path, you need to understand it's a process and that there is no quick silver bullet solution you can implement. The stuff you try and do may not initially look like it's making much of an impact because frankly, it almost never does in terms of what's observable. It takes time for this to bleed into how we work every day, which is when the transformational impact is felt. What we're really talking about is culture change and changing a culture that cares about their workers' well-being. When that culture changes and people believe their organizations truly care about them and are doing their best, we begin to see trust and people assume positive intention instead of the cynicism that's so often present. That alone provides a great deal of that psychological PPE I spoke about. Darcy mentioned I'm an occupational and organizational psychiatrist, and so for me, my job is to try to figure out how I can help workers and workplaces achieve optimal organizational functioning and maximum potential. And so I've taken those 6 concepts you saw on the last slide and boiled them down to 3 components that we use to build our physician well-being program. That's leadership development, creating a shared vocabulary and frameworks, and building infrastructure that allows us to expand capacity on the ground and harness the passionate local people that want to be constructive partners in culture change. In my view, it is then that we build that contagious momentum I spoke about that can create this culture change. First, I want to talk about leadership development and engagement. There's always this tension between whether this can be done top down or bottom up. And for me, I think both is best. But either is possible as you're seeing these roles of directors of physician well-being, chief wellness officers take hold across healthcare systems and C-suites increasingly being engaged. However, I believe that even if the C-suite is not engaged, we can't let that be an excuse for doing nothing, as I do think that bottom-up leadership has the ability to make positive change, especially if we develop those leaders at the bottom, as you'll see we have tried to do in a moment here. Second, as you're engaging leaders, you must engage them with a shared vocabulary and common framework that works for your local environment so that we're all rowing in the same direction. This is especially important around a generic term such as well-being, because if you ask 12 doctors what they need for their wellness, it's a good chance you'll get 12 different answers, which can paralyze change management efforts. For us, we've conceptualized well-being around performance. Again, the moral case is clear to me. When I'm speaking at the organizational level, we highlight that our mission statement at Northwestern Medicine is patients first. And for us to be able to achieve that mission, we must care about clinician well-being and remove any obstacles that prevent docs from achieving their calling to provide world-class patient care. This has been huge for us because basically we've expanded the notion of wellness from being about yoga and meditation to every function at our organization, from informatics to operations, is really doing a wellness intervention in the way that we've defined it, because everyone should be working towards creating an environment that improves our ability to care for patients. In addition to that conceptualization, we use a shared strategic framework to achieve our mission statement. We use the National Academy of Medicine systems approach to clinician well-being as our guide. It basically says that multiple system levels influence how we experience the demands of our jobs, which impact the outcomes of burnout and well-being. The 2 main things I want to highlight from this model are, 1, it again says everyone has to do their part and manage what's in their circle of control for optimal outcomes. Individuals need to work on their own self-care and resilience. Organizations and departments need to provide for their workers. And certainly the healthcare industry and government must do their part to create an ecosystem that reaches its maximum potential in providing care for our patients. The second part of that framework is that the organizational contribution has to be to optimize this balance between the inherent job demands of the work that we do and the resources it provides. This is frankly basically where I spent all my pre-pandemic time working on, and where I hope to spend all my time post-pandemic, so that the environment our clinicians work in is a healthy place. Finally, we must never forget to implement tactics to realize strategy. I see this mistake frequently where people have been very thoughtful, very deliberate in their planning, but they never actually do anything to really provide that tactical change that people can feel on the ground. There are ways to build your tactical response, including measurement tools that provide clarity on problem areas, focus groups, but at its really most basic, I would urge you all to simply ask your people, what are those annoying pebbles in their shoes that make their workday less enjoyable and inefficient? And start by removing the ones in your circle of control. These small wins generate so much goodwill and hope that it can catalyze much bigger change. For us, we've prioritized the following initiatives because they build capacity and infrastructure that allows the frontline people to be constructive partners and really help us to know what those pebbles are for them that need to be removed, and then design ways to remove them. I'll describe two of them that provide the core infrastructure of our program. Our flagship initiative is called the Scholars of Wellness. It's a 12-month-long curriculum that teaches physicians the 3 sets of skills and knowledge they will need to be effective change agents. First, they need to understand the well-being literature. 2, they need to understand how process improvement, project management works in the real world. And 3, they need to understand how to implement change management and be effective change leaders. These physicians partner with numerous system functions and coaches, which helps us take direct aim at removing the white coat versus blue suit culture that's often present in healthcare systems, and in my view is a major place where untapped potential exists. We also train these scholars, and we kind of use an identify, develop, scale, lead model, where we identify folks that are passionate about well-being, passionate about serving their fellow colleagues. We then develop them with our Scholars of Wellness curriculum and coaching. And then for those that demonstrate a lot of aptitude, commitment, we scale them into other places and other initiatives around the system and the organization. We then take some of them and we are able to put them in roles where they can lead and contribute all across our system and our organization. That has really been one of those visible ways that people have seen that, you know, there's a place for this passion. There's a place for us in this organization where if we contribute constructively, we have a chance to really make a difference. At this point, we'll have trained 28 scholars from all around the institution, and this really provides me, in my role, the ability to know what's really needed on the ground, since there's that bi-directional communication with my scholars. It allows me to have a friendly, trained partner in those departments to get quicker buy-in on the ground for adoption of future initiatives. And this is kind of what I was speaking about when I said, for me, it's best to have both top-down and bottom-up leadership. In addition to identifying, scaling, and developing people, the program allows us to use that same model with initiatives. Each scholar is responsible for creating a pilot in their departments where they apply the skills and knowledges they have gained, right? There's no way to internalize a curriculum better than actually applying it. We help them with coaching throughout the process, and we try to align their projects with broader system initiatives that we're aware of. This has certainly been very successful as an accelerator, as we have a chance to learn on a small scale what the benefits and risks of certain ideas are, how and who we need in the organization to be able to implement an idea. And we're able to take these smaller risks so we're not wasting precious resources and time to figure out which things are really needed. And so an example for us is our peer support program, which started out as an idea in obstetrics and gynecology and anesthesiology. We were able to stand up those departmental peer support systems, and we said, you know, this is great. This is really useful. There's no reason every physician doesn't need that support. And we were able to expand it to our whole central hospital in 1 year. And then the next year, our goal is to transfer it to all 10 of our hospitals. And to me, that's when we really start having this bounty that we can harvest and really see that cultural change, that transformative change that I spoke about in our journey. The next infrastructure I want to speak about is our peer support system, which we call P2P. And this really, to me, provides that physicians that hard hat, if you will, around dealing with adverse events that all patient care has from time to time. This infrastructure is foundational for us as it allowed other people an easier path to then develop ideas around providing support in different arenas. So what we were able to do is listen to folks that said, you know what, I'm really noticing that my tank is running low, and I'm just feeling a lot of compassion fatigue. And so providing folks support around that was an idea. As Darcy mentioned, and we all know, there was so many social justice issues that came up this summer. And so people said, you know, there's these examples of where physicians really deal with a lot of emotional abuse from patients and their families around discrimination, harassment, racial biases, gender biases. And so that is a special kind of hurt that needs its own sort of support system. And so people found using the P2P infrastructure, they were able to accelerate their development of such a program. And the same thing around peer review or legal support that's needed. Again, we look at the literature, this is one of the major times when physicians get burnout, frankly, even leave the field. And so being able to provide support during that time is something that we feel is addressing one of the occupational hazards of the work that we do. And so these two foundational initiatives have generated great momentum for us, and their success has allowed us to make the case that our program should really spread from our main hospital to all 10 of our sister hospitals. And through the support of leadership, you know, observing our program, our pilots, and the change that we've been able to make, we're grateful that we're going to have our ability to expand to our 10 sister programs, sister organizations this year. And so, you know, I'll certainly conclude with, you know, we recognize we have still a lot of work to do, but I think we were validated in our approach by being one of 22 organizations nationally to be awarded the Joy in Medicine distinction by the American Medical Association. This helps us feel like we're moving in the right track, and as we continue our journey, I certainly wish you all the best of luck, and you know, thank you for your attention, and happy to discuss further. Thank you.
Wow, thank you for such a great talk. I think there was a lot there in terms of really actionable strategy and tactics that can be used to help, you know, address mental health in the workplace. So I really appreciate that. Before we go to Q&A, I wanted to present one more poll that is for Right Direction. Emma, if you can go to the poll question. Perfect. All right, so which of the following do you consider the most valuable for the Right Direction team to offer? And I will give you about 1 minute to answer. All right, thank you. We can go to the next slide. Sorry, I have it very small on my screen, so having to squint to find where it goes to the next slide. Okay, so before we go to Q&A, we would first like to thank our generous support from Takeda and Lundbeck, who have helped provide the funding to provide all Right Direction resources, guidance, and materials absolutely free for employers and employees to use. And now we can go to Q&A. All right, so a couple first questions. One question that was asked by an audience member was that they noticed in the consensus chart that there tends to be less depression with people of higher age groups. Do you have any insights on why that might be?
Yeah, it's a fascinating question. It's really the exact opposite of who the illness, the medical illness, of course, impacts the most. I do want to highlight that survey is not diagnosing depression; it's identifying depressive symptoms, and I do think that's a really important distinction between disease and distress. It's obviously still very important, but I just really always like to highlight that there is that difference. In terms of why, I certainly have hypotheses, and people have had hypotheses. One has always been, people that are older have experienced other very difficult times in their lives, and they've learned the strategies that sustain them and help them, with their resilience. On the other hand, one of the things in terms of what's impacting youth has been that this idea of the intersection of stressors, that it's not just a pandemic, it's people coming out of college to a very different workforce, it's social justice issues, racial issues that potentially younger folk are sometimes more passionate about. It's obviously isolation. If you're in your 20s and you're dating, and this has really ruined that ability to be able to do some of those tasks of the 20s or 30s and teenager years. So I think those things are probably all an amalgam of the various buckets of stress that different age groups are experiencing.
Great. Another question we have is, as you consider employers outside of healthcare, what do you consider to be the greatest importance when it comes to stress management?
I think for me, my brain works in frameworks, and that's what I try to present to you all today. I still think no matter the industry you're working in, identifying a vocabulary around stress is important. I think highlighting that sometimes in our culture we have conceptualized stress as all negative, and that conceptualization has health consequences. The literature shows us it's not just stress, it's that if we think stress can only be harmful to us, that's when it's most harmful. And so I always highlight this concept of stress plus rest equals growth, that you need stress for growth to occur. And the example, of course, is around working out. You have to stress your muscles. And then the key part that is sometimes very, very difficult is you have to rest your muscles, and that's what causes the building of muscles. And so I think really highlighting that concept is useful. I think naming, helping folks name, and being much more nuanced about stress. That's why I present those 4 buckets, because for me, what we have found to be most helpful for people during this situation is really the folks that can kind of understand what's in their circle of control, what's in their circle of influence, what's outside their circle of control, and then focus in a laser sharp way at what's in your circle of control, seem to do better. That concept of control, decreasing uncertainty, feeling efficacious is really helps reduce that stress thermometer significantly. And then I think hopefully finally from an organizational standpoint, recognizing that yes, we do want to provide resources and supports to individuals, we have to then take a look in the mirror and say, what parts of the way we do business is contributing to stress, what are necessary parts of the job, and what are things that we can do this differently, we can design differently to remove these stressors.
Yeah, I think that's great advice, how to design differently. I really like that term, so I think I'm going to steal it. The next question, I'm sorry?
No, I was just kidding.
Okay. The next question is, given that many are working in a remote environment, what are some key messages to share with people managers and supervisors about, what to look for in employees who may be experiencing different rates of stress or burnout?
Yeah, that's a great question. It's a challenging question, frankly. A lot of the things that I've talked about assume you can see the person and you can notice the coffee stains on their white coat, etc. It is clearly important, and one of the most I think dramatic data points in this literature is that the immediate supervisor for folks is responsible for 50% of the satisfaction that people experience at work. And so I think the first part as a supervisor, as a manager, is to recognize your importance and how big a role you play. And then I think in terms of how to deal with that from a remote aspect, we have to continue to remember that the needs of people, what they get out of work, remain the same. And that this is about purpose and meaning and feeling appreciation and being able to, put together good work. And so really recognizing those things still in a virtual space is important. I think we have to make more time for weekly check-ins with people where we can do, using a platform where we can see each other and check in. There's also this concept of a buddy system, is making sure that people, we potentially create a system where if the manager obviously can't talk to everybody, that we assign 2 different people to check in with each other on a regular basis, I think is really important.
Great, thank you. I guess this is more almost like a clinical thought, a clinical question, but what is the connection between stress, burnout, and depression? I think you kind of mentioned this a little bit, but can you maybe elaborate a little bit more?
Yeah, I think we're still frankly learning about it. The way I look at it is, again, stress can be both acute, meaning kind of this one moment, or chronic, which is kind of long lasting, it continues to keep going. And I think a lot of people look at burnout as this chronic workplace stress that is not managed in a commensurate way with the resources that we give. There has been this argument that, is burnout just depression? And I do think there is certainly overlap, especially at the level of severe burnout. There's some overlap between people that are severely burnt out are oftentimes depressed as well. But I'm aware of literature that will be coming out shortly that has really looked at how do people's symptoms of burnout overlap with symptoms of depression. And it's actually really compelling work that shows that they don't really overlap that much. They really truly are 2 distinct different entities. And certainly we recognize some of those differences in that if I am depressed and I go on a vacation, generally nothing happens. I'm still depressed. If I'm burnt out and I go on vacation, I feel better. And so, in a simplistic way, that reminds us that these really aren't the same thing and shouldn't be pathologized in that same way. I think the World Health Organization really tried to highlight that in their definition, to say this is a work occupational related phenomenon, not a disease.
Right. Thank you. And we have one more question, unless anyone, actually, yes, we do have another question after that, sorry. When it comes to self-care, what can employees do, whether they're working remotely or on site, to manage stress and avoid burnout?
I think, again, I'm sorry to sound redundant. For me, the first step is to identify where your stresses are coming from, because they're likely coming from multiple buckets. Then step 2 is figuring out which of those buckets you actually have a lot of control in. So, for instance, the example I gave is one of the buckets was around moral stress, moral injury, values issues. And so for some of our healthcare providers, the last 6 months has certainly been some moral challenges around, who gets the vents if there's a shortage, who gets the ICU rooms, who gets the vaccines. The visitor policies was really hard, right? One of the core values is no one dies alone. And when we had to institute these visitor policies, I can't tell you how hard that was for the clinicians. And so, but to me, that is a stressor that is not really in your circle of control, right? That's an organizational policy. That's a pandemic response nationally. And so that won't be where you can spend much time in. And if you focus in on that area where you feel helpless, it really kind of snowballs. And then the real danger is that you don't actually control what is actually in your circle of control. So identifying the sources of those stress is important. I think one of the most common things that I'm hearing about is it feels like Groundhog Day, right? It's the same day over and over again. I don't know if it's Saturday because I'm working the same way. I don't know if it's 9 p.m. I'm still checking my email, returning calls, etc. And so that boundary issue, I think, is something that we're talking a lot about with people because, again, the brain needs time to unplug. It needs time to calm down. It goes back to that rest plus stress equals growth. And that rest portion is really, really important in that equation. And so that's one of the big things that we talk a lot about right now.
I'm just curious. I think, recently we've we're pulling in kind of like a different aspect of psychiatry. It's almost like an occupational or organizational psychiatry. Is that something that is kind of a budding, section of psychiatry that's starting to emerge, or are they teaching that in medical schools? I know it's kind of not really necessarily related to the topic, but there was a question on that.
Yeah, I mean, I'm glad you asked. It's it's a small group of us that do a lot of this work. It's been around for a while, but in some ways it goes back to that first Freud quote. Psychiatry has focused in on love and relationships, forever. But there was two things that he mentioned: love and work.
Right.
And so that the relationship to work is really a central part of our lives, especially in our culture. How much time do we spend at work, and at work has really been something that impacts all our health and our well-being and the rest of my life. And so I found it to be something that's really rewarding. I come from a family of immigrants, and so I watched my dad work like a workaholic his whole life. And so clearly this man was work meant a lot to him, and impacted his health and his well-being and his relationships. So it was just something that always inspired me. The Center for Workplace Mental Health is one of the major sources around people that are interested in occupational and organizational health. And so I've always been so grateful for the center to allow me to be a part of their advisory council. There's also an organization called the Academy of Organizational and Occupational Psychiatrists that helps bring our small group together and share ideas. And I think coming out of this pandemic, the nature of work is an open question, and someone has to be really thoughtful about what is that relationship going to look like? What are the challenges that occur if most of our teams are working remotely or only seeing each other once or twice a week? There's going to be great benefits, but the unintended consequences, the second order effects, are things that we need to design around and be thoughtful about. Otherwise, there will be a lot of fallout that I think people may miss.
That's a great point. Thank you so much for today's discussion. I think you provided a ton of useful information. Again, you can see on the slides, we're providing our website, our Twitter, LinkedIn. So please follow us on our social media, and thanks again for the great presentation. Appreciate it.
Thank you.